Welcome back. The next three that we'll be talking about are going to be involving infection, inflammation, and the immune system. All three of those are intricately interwoven within one another in the body. And infection is such a chronic issue for us that we don't even realize that we have infections that linger. Okay? We think about parasites and we think about third world countries carrying these horrible parasites and, oh, we go to another country, come back and have something. Well, we actually carry a lot of that in this country as well. And we do it microscopically. You can see it on the blood when you look under the microscope. You can test it in the bowels. You can test it in the stool. There's ways of looking at that in the body and figuring out how much infection are you carrying, and then importantly, what byproducts and toxins from those infections are actually metabolically affecting you. And we've seen where the energy production of the body can be affected by that, and that we all carry some of these things. And the main part of the sources of those infections occur in the gut. And a lot of this will happen under times of stress event. Something will happen that's particularly stressful. And the stomach now gets exposed to some infection, and it doesn't make the stomach acid that it would otherwise make to kill that infection. And it gets into the bloodstream or it gets into our bowels and begins to wreak havoc. There are other sources of chronic infection. Root canals. Time and time again we see when you look at the x-rays and you get the proper imaging studies done of the mouth, you will see that the source of the base of the root canals has some kind of chronic infection there. So we're exposed to these things affect our health, and ridding our body of these chronic infections is really crucial to your overall health.